Hi, thanks for joining us at LA Beauty Connect. Today we're joined by Dr. Danielpour and Dr. Layke, and we're going to be talking about therapeutic plasma exchange. Can you explain what exactly therapeutic plasma exchange is?
Yeah, listen, therapeutic plasma exchange has been used for a long time. It's essentially filtration of the blood, and it's really separating the red blood cells from the rest of the plasma that's in our system. And we can use this to treat diseases, we can extend lifespan, and ultimately improve the aging process.
How quickly does it work?
It works immediately because you're filtering the blood, but it also takes time because your blood has to make the new cells. And that's the beauty of this procedure. You're actually just making new fresh cells that your body is making to treat things. And it's kind of like what we call an oil change, right? If you do it for your car, why shouldn't you do it to your body? So you'll feel it right away, but it continues to work for a while.
How many times does a person have to do it?
Well, it depends. I mean, listen, someone with a severe autoimmune disorder, I mean, this is a type of treatment that's been used for decades. And this is used in cancer, it's used in autoimmune diseases. If someone has a severe autoimmune disorder, then you can do it on a monthly basis. For longevity and wellness purposes, we generally recommend 3 times per year.
Are there, if any, side effects?
Not really. I mean, if you've ever given blood before, it's very, very similar. It's just basically putting in a needle into one of your veins. Difference is it's for multiple hours. So the normal side effects that happen with just giving blood can happen here, where you can have, a little redness at the area, or you can have a puncture site issue. But generally speaking, systemic problems rarely occur.
Mm-hmm.
How long do the effects of one treatment last?
Yeah, again, I think that goes along with the severity of a disease process. If we're just looking at improving the quality of life, these effects can last for 6 months or more. And, that's why the idea is we want to do these once a quarter to try to stay ahead of the game. But ultimately, the effects will last for 6 months.
Since the therapeutic plasma exchange is known to reduce inflammation and support the immune system, is this something that you would recommend to somebody who is gearing up for plastic surgery? And if so, would you recommend it prior to surgery or after surgery?
Great question. And yes, I think it's great to do prior to surgery. Get yourself in your best tip-top shape, have really new, vibrant cells that are being made in your body. So when you're healing, it can really kind of help you heal. Now, Dr. Layke may think after as well, so it may be a good thing to do before now.
Yeah, look, I agree. I think prior would be great, and I would probably separate it by a month, because the idea is you want your body, again, we're clearing out a lot of the toxins that accumulate, the antibodies that have been created, immune complexes that can work against your healing process. And so if you can clear all of that out and allow your body to now repair itself prior to surgery, it's only going to make, improve the quality of the result.
So since you're doing a baseline test complimentary prior to somebody does the exchange, before they do the exchange, are you able to then supplement with the vitamins that they're specifically missing or need less of or more of?
The interesting part is that the labs that we are taking, ultimately, unless there's a severe deficiency in one of the electrolytes, we don't really have to replenish anything right off the bat. The whole goal of this is to filter the bad stuff that's in our plasma. And so ultimately, just by doing the filtration alone, that's going to improve a lot of these imbalances. So I don't know that supplementation's necessary beforehand.
So when people are coming to your office to get this done, who is with them throughout the process? Who is performing this on them?
There is a certified nurse that does what's called apheresis, or the actual removal and cleansing of the blood, who's there with them throughout the whole process. And myself or Dr. Layke always goes in and checks in as well. It's a very comfortable process where you watch a movie, make a couple phone calls, you could be on your phone or your iPad or your laptop getting business done or whatever you need to do. So it's not something that's painful or uncomfortable, or it's nothing like surgery.
So it is very similar to just giving blood. Or having
It's
blood
exactly, I
drawn.
mean, I give blood once a quarter, and it's exactly the same thing.
Yeah, just a prolonged process, right? Instead of giving blood for 10 minutes, you're there for 3 to 4 hours, but essentially the same thing.
So the magic question, everyone wants to know, how much does this cost?
We charge $9,500. I mean, it's a very complex process, and the machinery and the expertise required is relatively demanding, and so ultimately, we feel that that's a fair market value.
And there are very few places that do this, and we actually set ourselves apart because we reinfuse with albumin. Whereas a lot of other places don't, and they reinfuse with either saline or lactated ringers, and albumin is really a constituent of your blood, so it's actually just replacing like with like. It's a lot more expensive, but we feel like it's a better treatment.
Is this something that can help people who have psoriasis?
100%.
Definitely. Listen, again, it goes back to the fact that it clears autoantibodies. And so, these are antibodies that are essentially fighting against your own system. And that's why plaque psoriasis is, so prevalent. We see, these plaques develop on the skin, but it's really due to the antibodies attacking yourself. And so this will clear those antibodies and ultimately put you in remission.
Are there any to-do things to get ready for it or to do when you leave?
To get ready for it, not really. I mean, the only thing we do is we have a list of labs that we'd like to get, and one of the reasons we do that is because we like to follow and show the inflammatory markers and show, hey, look, you did this and your inflammatory markers have significantly reduced. Or cholesterol. The one thing that there is data behind is that this can reduce your cholesterol levels. The other thing is, after the golden treatment is stem cell therapy. And unfortunately, that can't be done in the United States right now. And we are currently in the process of opening up our own stem cell center in Cabo San Lucas, which is going to be open in the next month. So this is our way of getting people ready, cleaning everything up. And imagine now you're going to make your own new cells, but we're going to infuse you with younger stem cells that are going to be even more powerful. So by doing this first, you're really priming everything.
Yeah, I mean, listen, we obviously want people to be hydrated prior to the procedure. And because this procedure itself does leach some of the calcium out of the system, we give calcium supplementation the morning of and throughout the process. But otherwise, again, we just ensure that you are medically capable of undergoing the procedure, and then afterwards we monitor you.
I think Julie and I are ready to go to Cabo.
We're ready.
And
ready
then
for all of it.
get our tune-ups in Beverly Hills.
Yeah.
Love it.
This is so amazing. We are so excited for you. Thank you for joining LA Beauty Connect.
Thank you.
Of course.
This
Thank
is
you
so
for having us.
Thank
exciting.
you for having us.
Appreciate it.